Hi, I'm Michelle and this is Jen, and we are two of the certified lymphedema therapists here at MarinHealth.
Today, we're going to talk a little bit about the lymphatic system, lymphedema, and ways you can keep your lymphatic system in optimal health. The lymphatic system is an important part of your immune system. It is made up of a network of tissues, vessels, and organs. The lymphatic system has two main functions. One, to fight infection and rid the body of toxins, waste, and other unwanted materials. And two, to transport fluid from the tissues back into the bloodstream.
Lymphedema occurs when your lymphatic vessels are not able to adequately drain the lymph fluid from an area of your body. This fluid backup leads to swelling, and this swelling is known as lymphedema. Lymphedema is most commonly caused by the removal of or damage to your lymph nodes as a part of cancer treatment. In patients with breast cancer, this swelling usually occurs in the breast, trunk, arm, and/or hand of the side where the lymph nodes were removed.
Lymphedema can occur weeks, months, or years after treatment has ended. Lymphedema can cause decreased range of motion and increased risk for infection. Signs and symptoms include fullness, heaviness, and achiness. While most people do not develop lymphedema, some do. There is no way to predict who will develop lymphedema, but there are things you can do to lower your risk.
You have an increased risk of developing lymphedema if you've had one or more lymph nodes removed and/or if you've had radiation.
Healthy habits to reduce your risk of developing lymphedema. A healthy diet and exercise are important for overall good health. Try to maintain optimal weight through a healthy diet and exercise. This will significantly lower your risk of lymphedema. Gradually build up the duration and intensity of any exercise. Take frequent rest periods during activity to allow for recovery, and monitor the at-risk area during and after activity for change in size, shape, tissue, texture, soreness, heaviness, or firmness.
Maintain good skin care. Make sure that your skin is in good condition. Keep your at-risk body part clean and dry. Apply moisturizer daily to prevent dry or chapping or chafing of skin. Pay attention to nail care and do not cut the cuticles. Protect exposed skin with sunscreen and insect repellent. Use care with razors to avoid nicks and skin irritation.
Medical checkups. Find a certified lymphedema therapist near you. Review your individual situation and get screened for lymphedema and discuss your risk factors with your CLT. Ask your CLT or healthcare professional if compression garments for air travel, strenuous activity, or daily use are appropriate for you. If a compression garment is recommended, make sure it is properly fitted and you understand the wear, care, and replacement guidelines. Set a follow-up schedule based on your needs with your CLT and report any changes in your at-risk body part to your CLT.
Infection education. Know the signs of infection and what to do if you suspect you have one. Signs of infection could be a rash, redness, pain, increase in skin temperature, increased swelling, fever, or flu-like symptoms. If any of these symptoms occur, contact your healthcare professional immediately for early treatment of possible infection. If a scratch or puncture to your skin occurs, wash it with soap and water, apply topical antibiotics, and observe for signs of infection. Keep a small first aid kit with you when you're traveling.
Try to avoid these possible triggers: injury or trauma. Wear gloves while doing activities that may cause skin injury. For example, washing dishes, gardening, or using chemicals like detergent. Try to avoid punctures, injections, or blood draws.
Limb constriction. Wear loose jewelry and clothing. Avoid carrying a heavy bag or purse over the at-risk limb. Try to avoid blood pressure cuffs on the at-risk limb.
Extreme temperatures. Avoid exposure to extreme cold, which can cause rebound swelling or chapping of the skin. Avoid prolonged duration, longer than 15 minutes, to heat, particularly hot tubs and saunas.
Prolonged inactivity. At risk for leg lymphedema, avoid prolonged standing or sitting by moving and changing position throughout the day. Wear properly fitted footwear and hosiery.
Thank you so much for listening today. We hope you found this useful. If you need more attention for your lymphatic system, contact your physician and ask for a referral for a certified lymphedema therapist.
Thank you very much.